Hello, I'm Charubala Pavan and I would like to talk today about accreditation for oral healthcare facilities. This is a basic introduction. What is common between all these brands? We go to a shop and pick up a can of Pepsi. We go to a grocery store and pick up a milk packet of Nestle. We want to buy a phone or a laptop, we look for Samsung. What is common is that all these are branded and we recognize the quality which is provided by these brands. But if we look at quality in healthcare, there are different perspectives. Suppose we look from the perspective of a patient. Suppose my grandfather suffers from a heart attack and I would like to take him to a hospital. I would like that the hospital is close to my home. I would like to see that there's no waiting time and I'm attended to immediately. I would like to see that good, effective quality of treatment is provided. And at the same time, I would like empathy and care from all the nursing staff and doctors. But if I'm a doctor or a dentist, I would look at quality differently. I would want state-of-art machinery to work with. I would want my case results to look like textbook pictures. I would like my obturation to look like a textbook. I would like my case studies to be presented in research journals. That would be my idea of quality. If I was from the insurance sector, I would have a different set of demands. I would want transparent billing. So what is the common thing between all these stakeholders where quality can be assured? Whether you're a patient or whether you are a doctor or whether you are from the third party like an insurance sector, I would say that the common thing between all of these is accreditation. Simply put, accreditation is a voluntary process in which we are evaluated by our peer, by other oral healthcare professionals from our fraternity who are assessors who will come to our practices and have a look at the standards we follow and evaluate them against preset standards by the accreditation organization and see where we stand with respect to them. Why do we undergo accreditation? There are several reasons. First and foremost, we create a brand. Secondly, more importantly, as an oral healthcare provider, we want to set a benchmark in the standards we achieve in terms of infection control, in terms of patient safety, in terms of employee satisfaction, etc. Also, these days, for empanelment in CGHS or ECHS or Ayushman Bharat or even in certain government schemes of Telangana and Andhra Pradesh governments, we need accreditation. If our practices are in a place where we have international patients for medical tourism, then it becomes important that we have a brand, and that brand is provided by accreditation. If we want our bills passed by the insurance sector, these are some reasons why all of us would want to enter into the journey of accreditation. Today, we have two very important national accreditation agencies. One of them being NABH, which is an older organization, that's National Accreditation Board of Hospitals and Healthcare Providers. And a second and newer organization is Quality and Accreditation Institute, which is catching up very fast and expanding really well. Now, the common thing with both these organizations, whether it is NABH or QAI, is that they are both recognized by CGHS, which means they are on an equal footing. We also have international agencies like JCI, that's Joint Commission International, which is an American organization which also certifies standards. But having said that, I would like to say that both NABH and QAI are also international organizations as they are accredited themselves by ISQA. So these are some organizations which we can think of if we want to get accreditation for our institutes. So how do we get accreditation? First, we go through the standards in both these organizations, or even JCI if we would be interested in that. We see where our practice falls with respect to the standards and objective elements provided by these organizations. If there are any gaps, we would like to close them and then start with the application process. Along with the application process, certain documents would be required which have to be submitted. After that, an assessment date is provided by these organizations after the payment of fees. After that, we have the main assessment process in which we have these principal assessors who will come and have a look at our organization and see where we stand with respect to these standards. If there are any non-compliances, they will be pointed out in the form of a report, and we will be given time to close these non-compliances. If the non-compliances have been closed satisfactorily and our practices are following the standards as prescribed by these accreditation organizations, we will get the certification by these agencies. So that is the process in brief. Today, we are all brand ambassadors for oral health care. We are people in society who are looked on by all the patients as the ideal people to take care of their oral health. But what if these patients are our brand ambassadors? And what if our employees are our brand ambassadors? They will definitely be so if we enter into the process of accreditation, because these are exciting times. Employees get to learn new things. Patients see changes around practices. So let's take one baby step at a time and try to fulfill this process. We will come through hurdles. We would find it overwhelming at times. We would find that, following all these policies, procedures, training your staff is a little overwhelming at times. But believe me, I have been to one-chair practices as well as huge hospitals and dental colleges, and they have all been able to do it with a positive attitude and with a feeling of perseverance. So if any of you are interested in starting the process of accreditation and have doubts or would like to ask some queries, these are my contact details, my WhatsApp number, as well as my email ID. If you are interested in more such videos, do like and subscribe to my channel. And my next video is going to be about the legal requirements required to start dental practice in India. Thank you.